If you're just getting ready to go on Medicare and you're excited about Medicare Part D drug program, maybe temper your enthusiasm a little bit, because oftentimes it's not as good as the drug benefit that you got while you were working on your employer's health insurance or your spouse's health insurance. People typically expect it to be as good as better, and they're a little bit let down. So we're going to temper your enthusiasm. Now, when you choose your drug plan, that's one of the things we help you do at the Medicare Family, is we ask you all the medications you're taking, your dosages, if they're brand or generic. We try to find the plan that covers all your drugs at the lowest annual cost. So we're going to help you do that research. And we're going to say, we recommend this company. It shows your drugs at the lowest cost. That's your total annual cost. But then the insurance company, they can throw some wrenches into that to make it a little bit more difficult. So what they can do is they can say, you know, we do cover Eliquis. Eliquis is I think it's the most expensive blood thinner, and it's definitely one of the most popular. We will cover Eliquis, but since it's so expensive, we are going to require you to take a couple steps before you get there. Medicare Part D, which works the same inside a Medicare Advantage plan. Step therapy means, yeah, we cover this drug, but we want you to try the cheaper drug. And if it doesn't work, try this other cheaper drug. And if it doesn't work, try this intermediately priced drug. And if it doesn't work, yeah, we'll cover it. So that can seem like some unnecessary hurdles and delays and can be frustrating, and that is what it is. Every year they get to decide what drugs they want to cover and then what barriers they want to put up there. Step therapy is a barrier. Now, if you already were with another drug company and you went through the steps and now you're just switching plans, they have to honor that. So you're not going to have to do it every time you switch plans, thank God. But you might have to do it once to get that drug. And you might say, if my doctor thinks I should be on Eliquis, why would I want to take one that my doctor does not want me on, and my doctor has a good reason why she told me she doesn't want me on this cheap one? Couldn't that be dangerous? Yeah, it could. This is the system that we have. Yeah. So some people say, well, I don't want to do that. My doctor said I'm in a precarious situation. I want this one. Then you would have to pay for it out of pocket. And there's not a lot of people in that position to just say, oh, forget it, I'll just pay out of pocket. For most of us, we'll have to go through the steps, otherwise known as the hoops, to get to the drug that our doctor has prescribed. Now, there's something else on Medicare Part D that can be a barrier to you getting your drugs. Even though our team, the Medicare Family, researched your drugs and we said, yes, this insurance company does cover your drugs, they can put another hurdle on, and that is called prior authorization. So your doctor can say, yes, Sylvia needs to be on whatever, some expensive drug, based on the doctor's medical evaluation of Sylvia. But then when I go to the pharmacy with my prescription, they call it in and they ask the insurance company and they say, no, we don't really think you need that drug. Go ask your doctor for another drug. Prior authorization means, I don't care what your doctor said, the insurance company is going to be the final determinator if I get that drug or not. Prior authorization. Now they can say, no, we deny it. And then I can appeal that. So there's some back and forth we can go on, and I might win. My doctor hates this part because you have to do the paperwork and it's unpaid extra work for your doctor's office. They don't like it. But this is another barrier for the insurance companies to say, we cover your drug if you go through our hoops, our step therapy or our prior authorization. And remember, just because an insurance company covers your drug today, in most cases, doesn't mean they have to cover it tomorrow. They can give you 30 days notice and say, we're changing the list of drugs we cover. And there's some exceptions where you can continue to get your drug, but in general, you need to know the drug companies have flexibility. They have a lot of flexibility, but you don't. Because for most people, once you sign up for a Medicare drug plan, you are locked in for a calendar year. And then you can change at the end of every year. We call that the annual election period from October through December. So you're saying I'm locked in, but the insurance company's not locked in on the drugs that I decided to buy? Yeah. Don't kill the messenger. I didn't make this stuff up. I'm just trying to help educate you so that when you're ready for Medicare, even though it's frustrating, you at least understand how it's going to work. Thanks for watching. If you like this video, you might really like this video. Check it out. And we'd appreciate if you subscribe to our channel so you never miss a great video. We put out one every week. Check in the description below this video for a link to our cheat sheet on Social Security and Medicare. And you can also give us a comment if you have a specific question. Always feel free to call us or email us at the Medicare Family.